bill. Let's start tonight with Republican reaction in the House. Joe Barton of Texas. Congressman, good to have you with us.
Glad to be with you, Ed.
You know, the president today, his purpose was to come out and say that he was going to accept some provisions of what the Republicans have put out on the table all along. Are you comfortable with what you heard, based on some things like going after waste, fraud, and abuse? What do you think?
Well, of course, we're for ferreting out waste, fraud, and abuse, but mostly what the president said in terms of Republican ideas is just window dressing. He mentioned medical malpractice reform, but what he wants is a pilot program that really prevents states from imposing any kind of caps on medical malpractice issues. So that's not, in my opinion, real reform.
Okay, well, the president says he's willing to commit $50 million to fund state initiatives designed to reduce medical malpractice costs. Now, I've spoken with a few legal beagles today. They say that this is a great start, and it will undoubtedly have an effect on cases which would favor the position of the conservatives. What about that?
Well, real medical malpractice reform would be to take the bill that Texas passed in 2003 or that California passed in 1975.
But is this a change, Congressman? I mean, this is $50 million geared on a state level to address what your side of the aisle has said, frivolous lawsuits.
Well, if you look at the fine print, states can't put any kind of a cap on punitive damages or lawyer fees. They don't have disproportionate responsibility or things like that. So it's really, you know, any step towards reform is a good thing, but in terms of really changing the system, the president's proposal on medical malpractice reform just doesn't do it.
And what about boosting Medicaid reimbursements to doctors? That's something the Republicans have wanted all along.
We would be for that. I don't know the details of that proposal, but that's something that we could support.
Okay, well, that's in there. That's what the president says he wants to do. So we can say tonight, whether you vote for it or not, there are some Republican ideas in this bill.
Well, it's we think it's going to be a 2,700-page bill, and to have 3 or 4 paragraphs that are things that we support does not make this something we can vote for.
But Congressman, if I were a doctor and someone told me that if I treat patients that are in a government program such as Medicaid, and there's going to be reimbursement to the doctors and I'm going to get more money, I mean, I would think that would be a good thing. I'm getting paid more for my services. Well, that is a Republican issue. How could you not embrace that?
Well, you know, one thing that's a good idea doesn't make the entire bill something that we can vote for. And 160 mandates and new commissions, requiring every person to have health insurance whether they want it or not, requiring employers to offer it whether they want it or not, spending $1 trillion.
Half the Bush tax cuts. 1.8 trillion was the Bush tax cuts. Yes, it was.
It doesn't compute, sir.
It does. The Bush tax cuts were 1.8 trillion, Joe. You know that. And this bill is half that. And the CBO scores it. It's going to save money over 10 years.
Well, it saves money according to their scoring because it counts 10 years of revenue increases and only 6 years of spending. That's what most people would call a gimmick.
All right. So, Congressman Barton, the $64 question, will you vote for it?
I do not plan to vote for it, and I don't think they have the votes to pass it.
Well, we'll see. Congressman, good to have you on tonight. Good sport.
It's always my pleasure.